Welcome everyone to this webinar on specialty training in paediatrics. My name's Eloise Rogers and I'm the RCPCH Medical Recruitment Coordinator. Also in this webinar, we've got James Clark, who's the Head of Medical Recruitment at the college. We've got Dr. Blanche Lum, who's the Trainee Representative for Recruitment. And we've also got Dr. Simon Broughton, Officer for Recruitment. This webinar will be recorded and it will be available on the RCPCH YouTube channel from next week. At the end of the webinar, we'll be finishing with a question and answer session. So please do add your questions to the chat as we go through the webinar. And you should be able to see the icon at the top. It's got a question mark and Q&A, so post your questions in there, please. And as this webinar is about ST1 and ST3 recruitment, if it's not obvious in your question, please just let us know in the chat which one it is about, and we'll answer those at the end. So thank you very much, and I'm going to now hand over to James Clark to start the webinar.
Many thanks, Eloise. Thanks to everyone for attending or for watching or listening to this back afterwards. Just give you a quick run through what we're going to have a look at today. So I'm going to start off just by covering a couple of points about eligibility, which are quite important for either level. Then we'll have a quick talk through the structure of how the specialty recruitment works and how it will work for this year, taking in all the various different stages. Simon and Blanche will be talking you through the sort of shortlisting and interview aspects as well, and they'll be giving you a few kind of hints and tips on how to do well at both of those areas. A little bit of time frame and additional guidance, and then we'll head into that Q&A that Eloise mentioned just now. So the first thing we'll just talk about is a couple of areas of eligibility that you should be looking out for this year. ST1, which we are obviously aware is already open. The main thing to keep an eye out for there is something that's been reintroduced this year that used to exist a few years back. Essentially, we have now asked for a maximum level of paediatric experience for people applying to ST1. So this is at the point of application. You must have no more than 2 years in paediatric posts. So these are posts excluding foundation, so it could be in any of the paediatric subspecialty areas, but you must have no more than 2 at the point of application. Obviously, you could carry on doing paediatric posts up until the start of your post, so you could end up doing a little bit more, but we're just trying to focus people in to make sure they're applying for the levels which are appropriate for them, essentially. Reiterate again that this doesn't change the standard approach to ST1 recruitment for paediatrics, in that we don't require for anyone to have any particular paediatric experience, but we're obviously very aware that a lot of people now do sort of F3s, F4s and so on, and may well go on to get more paediatric experience. So do just bear that in mind. There's plenty of space to make that clear on the application form. There is a question in there about it. So you just need to make that very clear, and just count your time before you've applied to make sure that you don't exceed that 2 years, I say, at the point of application. And then for ST3, so the key point there is that ST3 is the only higher level that we're actually recruiting to now. So there used to be post ST4 up to last year. That's now been removed with the introduction of the new paediatric training pathway. So ST3 is the higher level entry point currently for paediatrics, and will be for the following year. So that has the same criteria of eligibility, but I'll just highlight the kind of main 2. The first of all, which is around the MRCPCH exams. So you need to have 2 of the 3 written, so you don't need to have full MRCPCH to apply to ST3. However, if you do, great, that will save you a bit of time when you're actually in training. And also, there's no limit on prior experience, but we must have 6 months in general paediatrics, and there must be 6 months in a neonatal setting as well. So there's some quite clear guidance about this in the guide, and in the new core capabilities form, which will be going up on the website tomorrow. So there's a new section in that, which means that you need to be able to detail those 6 months in general paediatrics and 6 months in neonates, with a few of the kind of core skills that are required for somebody starting at an SD3 level post in the paediatric training pathway. When you do fill that form out, you need to link that as well to your employment history in the application form, but there'll be plenty of clear questions there that make it obvious how you do that. Just on the core capabilities form, so that's the form that you evidence what capabilities you've got in paediatrics so far to make sure you're equivalent to somebody at SD3, and this does need to be signed off by a previous supervising consultant. Those consultants can be from anywhere, so if you've been working overseas, they can be your overseas consultant, but you just need to make sure that they are completing that as fully as possible with comments as well as ticks against your eligibility. So just an overview of how paediatric specialty works. So it's a 4-nation process, and that's always the case. So we're recruiting into posts in England, Northern Ireland, Wales and Scotland. That's the same for SD1 and SD3, and the same actual physical process for both SD1 and SD3. So there'll be longlisting first. So that'll be much more basic eligibility, and then shortlisting, which we'll talk about a bit more. And then a virtual interview, which will include 2 virtual stations, and Simon's going to talk you through the various different scenarios that are involved in that. And at the end of the interview process, all the interview scores are piled together, and there's a final ranking across the UK, and that's from what point you will be given your preferences, depending on where you sit within that. And I'll explain the preferences a little bit more shortly as well. So the application process is all through the Oriel system, which you may be familiar with, but that's the national recruitment system. If you don't have an account set up, particularly if you're applying to SD1, which is open now, or even to SD3, which is open later in the month, make sure you do it as soon as possible so you got it all ready. All the applications for all the different medical specialties take place at the same time. So if you are applying to one specialty, then you'll apply through Oriel to the various different vacancies, and they'll all be at the same point. So as I say, the application window is open for SD1, so that's the same for any entry-level specialties. So that closes on the 23rd of November, so you've got a fair bit of time left still before that closes. SD3 will open later in the month from the 16th of November, and that closes on 5th of December. So you've got a bit of time there, and it's about three weeks or so each time. And as I say, just be aware of those eligibility requirements I just went through, and in fact all the other bits on the person specification, which can be found on our website and also on the NHSE specialty recruitment website as well. And do refer to the shortlisting guidance as well as the overall applicant guide, which we'll go through in a bit more detail. So long listing, as I say, is based on the basic eligibility criteria. So that's the person specification stuff, and those couple of bits that I mentioned at the beginning. When you're completing your application form, do give yourself enough time to do it and get prepared, because you've got the standard medical application form, which all of the medical specialties will be using, and then you'll have a paediatric specific section, and again that's for both SD1 and SD3. There's a white space section at the end, so where you can write your free text answers, and that's based on the questions that you'll see in the shortlisting frameworks, and that's what you'll be scored on when it comes to shortlisting. So there's a shortlisting framework for both SD1 and SD3, and they are both also to be found on our website, on the college website. So make sure you have that open while you're completing those white space bits, and also have a listen to the sort of advice that Blanche and Simon will be giving you shortly as well. Once the applications get to the shortlisting phase, so once you've completed, once you've been ticked off the basic eligibility criteria, the shortlisting is completed by 2 assessors for every application. So these are all done independently, but you'll always have 2 people marking each application, and they'll be done over the course of sort of 3 weeks. There's 2 windows which I'll just pop there just to give you an idea. So shortlisting for SD1 starts before Christmas and finishes on the 15th of January. SD3 then starts pretty much straight after that one's finished, and that fits in with the way that the interviews are staggered as well. The invites to the interview will come out via Oriel as well. So as soon as the shortlisting has been totted up, there will be a number of interview slots that have been set up across the various different virtual centres. And those that fit into the that sort of top amount will be sent an invite for a interview. So it's a first come first serve thing. It's quite a short window. So as soon as you know you've been shortlisted, make sure you keep an eye on those dates so you can log on to Oriel. Obviously, you don't have to worry about kind of where you go in the country, because you'll be able to do it from your home. But you just need to make sure that you can get the date that you want for ST1 in particular, as they're spread across a few weeks. Just a note as well that when you get that invitation for interview, you will get an applicant declaration form which you need to complete before you'll be able to sit your interview. So just make sure you keep an eye on that as well. And just finally, the preferencing. So this is the sort of area whereby you choose where you might want to work if you get your paediatric post at the end of the process. So the preferencing for both levels is not open during the application period, just to make that clear. So once shortlisting is complete and everyone knows who is coming to the interview and who isn't, if you've been shortlisted for interview, then you'll be able to access the preferencing window. And you can preference as many options as you like from anywhere across the UK. So from across those 4 nations, you'll have a number of posts. There's like to be around 440 posts-ish, might be slightly more for ST1. And ST3 will likely be in the region of about 140, but again, maybe more, bearing in mind that this year there are no ST4 posts, as I say, and everybody's entering an ST3 if they're coming in at a higher level. When you're preferencing, as I say, you can preference as much as you like. So, you know, don't limit your options, absolutely, but also don't pick anywhere that you're sure you wouldn't want to go to, because you never know, you may get offered that post. And unfortunately, declining a post in the offers process does mean that you're out of the system for the year. I'll explain the offers process towards the end of this talk, but just bear in mind that you can, I say, pick as many as you like, but just be careful you don't put anything that you really don't think actually, if you were offered it, you would definitely go for it. You can keep changing your preferences though as well, right up to the end of the offers process. So there's plenty of opportunity there. Very aware that people's circumstances can change quite late on, so that's always open for you to go back and change your preferences. Okay, so I'm going to pass over to Dr. Blanche Lum now, who's going to have a talk through the shortlisting questions on the application forms for ST1 and ST3.
Hi everyone. So the shortlisting questions are the questions which are what James referred to as the white space questions, and these are the questions that will kind of give you your ranking and differentiate between each candidate. I'll run through them quickly. Obviously this covers ST1 and ST3, so if you have any specific questions about either level, please just pop them in the chat. So the first section is additional qualifications, really straightforward. It's just important to note that intercalated degrees do not get you any points in this category. They got removed last year, which is a national decision. It's not just in paediatrics, so it's across the whole board. So they do have to be a postgraduate diploma, certificate, master's, rather than an intercalated degree, and that's true for any specialty. So if you weren't aware of that, just so you're aware now. The next section is clinical skills. So as James has already stressed, at ST1 we don't expect you to have any paediatric experience. It's fantastic if you do, but if you don't, then that's okay. And just talk about anything you think is transferable for ST1 in paediatrics. So have you dealt with children in A&E or in a different setting like GP or TNO? Have you seen or managed something in a similar way and recognise how you could transfer that into children? And clinical skills can be practical skills, things like putting cannulas in. They can be communication skills, assessment skills, managing a sick patient, anything that you think is a skill counts. It's not just like your practical skills, which a lot of people do think it means. It can be any kind of skill. Importantly, at ST3, make sure you read the shortlisting information that's available on the website, is because the higher levels of these marks want you to evidence some specific skills as you're going in at that higher level. So just make sure you don't shortchange yourself. If you've got those clinical skills, you make sure you put them in your descriptions, and that information is available on the website. The next section is your clinical experience and reflection. So again, we're looking at your experience of paediatrics at ST3, but at ST1 it could be transferable experience, so working with children in any other situation, clinical experience working in different specialties that you think will be useful going forward. And then the most important part of this section is the reflection and how this links to what you think being a good paediatrician or career in paediatrics is. If you just list experiences, you'll be quite low in the marks and kind of clinical experience. If you look at the shortlisting, the higher marks come when you show your reflection on what you've learned from it and how you think that's going to help you be a good paediatrician going forward. So just make sure you describe what you did, but also reflect on it, because that's what's really important in paediatric training. They want to see evidence that you can learn from reflection, as that's a key part of the training program. Going on then to QI and audit. So this is just looking for what experience you've had at this. Obviously, if you're ST1, you might not have as much, but you should have all been involved in QI or audit. So that can be data collection, or having designed or led an audit yourself or with support. And then they also want to know, have you presented it, or has it had an outcome which has changed practice? And that can be at local meetings or regional meetings. It doesn't have to be a high level national meeting. At ST3, again, we want a bit more from you just because you're going in at that high level. And that means that there's some elements that are in the ST1 one, but it goes a bit beyond that. So we want to see that you've got some reflection and you've shared the results of those, and there's some change in practice as the higher levels in that one. But at ST1, you just need to evidence your involvement in it and your kind of presentation of that, which can be local. Leadership and management then is the next section. So lots of people worry about this section, especially at ST1, but I wouldn't worry about it too much. Everyone does leadership as part of being a doctor, so you should all be able to write something in this section. Classic ones that we talk about is involvement of rota, or a leading role in some kind of organisation. Again, it doesn't have to be in medicine. So if you work with scouts or guides or children outside of work, or you are on a school board, something like that, anything that shows some leadership or management experience you can put in this section. And again, to get those higher marks, it's all about reflection. So what did you learn from it? What was your direct involvement? And what impact did you make to get those higher level marks? In terms of the ST3 for leadership, it's just a little bit more kind of evidence that you've made an impact and reflected on that we want compared to ST1. But again, you can use any role. It can be medical or not outside of medicine, but we want to see your reflection and evidence of your leadership and management skills in that. Academic or research is the next section. Again, one that people worry about. Again, I wouldn't ever have an empty bit of your application, and everyone can kind of write how they've been involved in research. Is something we do every day in paediatrics or outside of paediatrics. So you must have had some experience, even if it's just completing kind of your training that is part of, I think, F2, you do your GCP. The higher levels, again, a good description of a research project with publication. So if you've done that, that's fantastic, put it in. But if you haven't got a publication, or you haven't presented it anywhere, that as long as you've been involved in the project and even done some data collection or been involved in setting it up, then that all counts as kind of academic achievement research. In the higher kind of ST3 application, again, it's just asking you to show a bit more, because you hopefully would have been more involved in recruitment to studies or data analysis and data collection, and you can write about that. The next section then is teaching. So again, most people are involved in teaching day to day, and it's normally teaching of medical students or colleagues. So main thing is describing how you've been involved in it. If you've designed it yourself or led on any, that's great, and make sure you put that in. And then to get those higher marks, again, showing some evidence of feedback or evaluation. And if you've made any changes in response to that evaluation, that's also fantastic. Again, at ST3, we're just looking for a bit more range of style of teaching. So if you've done bedside teaching or lectures or webinars as well, we just want to see a bit more variety to get those higher level marks. But otherwise, it's just about having shown evidence that you are involved in teaching, ideally that you've designed or led some teaching, and then getting feedback and how that's changed your practice is also important. As you can see, a lot of this links back to the reflection, which again is really important in paediatrics. And finally, the last statement is probably what people think is the most important. So what makes you suited to a career in paediatrics? So what we want to see, especially at ST1, is that you understand what being a paediatrician is and what a career in paediatrics means. So not just the easy bits or the happy bits. We want to know that you understand there are difficult parts of paediatrics, that sometimes we have to do safeguarding, other things like that. So showing that you understand that and you're still motivated to get involved is really important. Describing kind of your motivation and understanding, as well as any personal attributes that you think mean you're suited to that, is a really good answer. And you can add in kind of why you're suitable and why you think you'd be a good paediatrician for ST1. And then ST3, obviously you're a bit more set on doing paediatrics. We just expect a bit more in kind of understanding in terms of your motivation and the specialty you might want to go into and your future kind of career progression. And that's kind of the main difference between ST1 and ST3. So ST1s, don't worry if you don't know what you want to be, you just want to be a paediatrician. As long as you understand what that means and what that involves, and you can show why you'd be good at that, that will be enough. And then at ST3, it's just a little bit more to show you thought about where you're going to go in those next kind of 4 or 5 years once you get in at that higher level. So the ST1 scores out of 60, and you get 2 lots of 30 marks. So each assessor, you'll be marked by 2 assessors, and each assessor will be out of 30. And then ST3, because you've got a little bit more evidence to provide, is out of 35. And again, it's 2 assessors who will mark your scores. And that's, I think I've missed anything.
Thank you, Blanche. I think I'm going to hand over now to Dr. Simon Broughton, who will take us through the interview process.
Yeah, really nice to chat to you guys today. As Blanche was talking through the shortlisting process, another sort of tip is just to make sure you get somebody else to read it, read your white space answers before sending off, and even someone who's not involved in medicine, really just to kind of read through the quality of what you've written will be really useful. But also your supervisors, and share it with as many people as possible to make it as good as possible before you send it. So let's move on to interviews. So roughly 650 ST1 interviews will take place between February and March, and probably around about 300 ST3 interviews. Might be about 250, might be slightly more than 300. It depends on the organisation. Both of these are 40-minute interviews. Obviously, the expectations for ST1 at the interview and ST3 are very different. So for ST1, we don't expect any prior clinical exposure to paediatrics. It's obviously useful if you've had it, but the reason is that we, if we feel that we can't train paediatrics within 7 years, then clearly we're not doing a good job. So ST1 we don't expect any prior knowledge, but ST3 we expect a lot. So there'll be 2 assessors in each station. To be appointable, you need to score over 55%. This does not mean you will be appointed. The average sort of appointability score where someone actually gets a post is probably more closer to 65–70% by the time the rankings are completed. And all of the candidates are ranked according to their scores, from the highest score down to the lowest. And then those, and James will talk you through the rankings and how that feeds into what post you get later. Next slide. So the scenarios, so there's 4 scenarios for ST1. So the first one is communication, and really this is probably the most important in terms of what we want from a paediatrician of the future, because communication skills are so essential in everything we do. You will be going through a role play with a role player, an actor, and they will either be playing a teenager or more likely a parent for ST1. And you'll be asked to explain a relatively common scenario, and the knowledge and information for that scenario will be transferable from what you know from adults. So it will be the common conditions, mostly diabetes, asthma, sepsis, seizures, etc. And you'll be expected to have a conversation with the parent to talk through the what's happened to their child, and you'll be given that information, what the plan is, and then to make a plan together going forward. It's really important when you're doing the communication scenario that you always take the time to pause and listen and make sure that the role player really understands what you've said, and listen to the cues that they're giving you. If you talk over the role player, you'll be really marked down, because this is a real test on communication skills. It's not really a test on knowledge. So the next scenario is career motivation. it'd be worthwhile for you to prepare a portfolio. You won't be demonstrating that to us during the interview, but it'll be useful for you in your shortlisting answers, but also to have next to you during the interview. Really things that have motivated you to want to follow a career in paediatrics, what your kind of best achievements are, either within university and medicine or outside of medicine, you know, something you do, a team sport or something individual that you've done and led on, and then demonstrating why those things would help to make you a good paediatrician of the future. Role modeling is really important in all aspects of medicine, and you'll be expected to kind of talk through who's inspired you to want to do paediatrics. Clinical reasoning. So this is a clinical scenario, but as with communication, it will be on a common scenario that you can transfer that information from what you know from adults. So this would be the level of information that we'd expect an F2 to know and understand. Obviously, many people applying will have up to 2 years of experience and will have more information, but the questions are set for people who are coming from F2 and at that level. You'll be given the scenario during the interview. You'll talk through the management. The key thing for you to do here is not to try and do it all by yourself. So you will be answering it as an ST1. Clearly, you're going to need help from the nursing team, from your middle grade, possibly from the consultant, and from other healthcare professionals who'll be with you and, you know, managing this imaginary patient. And so really important to kind of point out your role as a team member and what your plan is for the child and how you plan to escalate using, you know, tools such as SBAR, etc. And then the final scenario is the final interview question is reflective practice. You'll be asked to reflect on a clinical situation where something either went really well or something went not so well, what you learned from it and what you've taken away from it, and then how you've disseminated that learning at a wider level. So it kind of feeds a bit into governance. And as Blanche was saying, reflection is so important, and so that's why we've given it, you know, this amount of time in the interview, and demonstrating that you've learned from a previous clinical event and what you've taken away from it and how you've disseminated that learning is so important. So read through the question, which is on the RCPCH website. The question itself is published and it will be read out verbatim. So, you know, you really need to prepare for this. You know what's coming up. Make sure you're ready. Next slide. So these are our key attributes for an ST1. So if you look down this list, we've generated this list a few years ago now. And, excuse me. If you look down this list, you'll notice that the word knowledge is missing, and also the word experience is missing. So because they're things that we expect to be able to train during the 7 years plus of a paediatric training. But these other aspects are the things that we think really make a good paediatrician, and you know, make someone who's desires to do paediatrics and is going to have a really good time doing it and contribute towards the healthcare of children across the country. So these are the things we're looking for, and we're really focusing on these generic competencies at foundation F2 level, with an application to the paediatric questions that I've talked about as I've been going. So moving on to ST3 for the interview, it's the same thing, 40 minutes, 2 20-minute interviews. So the communication scenario is clearly going to be harder than ST1, and it's likely to possibly be with a teenager that you're speaking to, or to a mum, and will involve a safeguarding case, etc. So safeguarding will not really be part of ST1. but is definitely part of ST3 interviews in terms of expectations of knowledge. Or it could even be a kind of neonatal management case. And again, neonates is not part of ST1. But otherwise, everything I've said in ST1 is applicable here to ST3. It's a communication scenario. It's not a knowledge scenario, but you obviously need the knowledge to be able to communicate effectively. Reflective practice, again, is the same as what I've said for ST1, really demonstrating that, that reflection of a clinical event that either went well or not well, and what you learned from it and what you took away. We're expecting a slightly higher level than we would from ST1s because you've had more experience by this stage. The clinical reasoning scenario we will expect you to have at least 2 years of, or at least a year anyway, of paediatric knowledge. And we will expect you to have a good understanding of safeguarding, good understanding of common neonatal conditions, and a good understanding of paediatric emergencies. And we'd expect you to be able to start the leading of the team in this scenario. So we're expecting you to play a higher level person within the team, and but still to work effectively with all of the members of the team, the nurses, the other allied healthcare professionals, the consultants, possibly arranging transfer from a DGH to a tertiary hospital using a retrieval service. And the questions can be anything from the whole of paediatrics. So then the other thing which is different from ST1 is that the fourth station is governance and leadership. So we will give you a scenario where we will expect you to talk us through the immediate management of a scenario, and patient safety is obviously the key to, as it is to all of these situations that I've talked through. So if you start answering and just talk about the governance and leadership aspect, but don't talk about the actual management of the patient, you will get marked down. We expect you to at least acknowledge that and to manage the patient, but then to think about how we go through the governance framework, how this is reported, thinking about a DATIX or a SI report, and dissemination of learning. And then also we will talk through your leadership competencies. So we would have expected you to have led a team by this stage, a small clinical team, and we'd expect you to talk us through how that leadership feels and what you learned from it, but also who has inspired you with really good leadership skills and why, and how you're going to take that forward in the future. So I think that's the end of my slides. I'll hand back to James.
Thanks very much, Simon. And before I do the last couple, I think Blanche is just going to run through just a few general hints and tips as well about the application and interview process.
Yeah, so just Simon's stolen one of mine already. So starting with the application, I think it's really important to set your oral account up early. The white space questions are the bit everyone focuses on, but you still have to fill in all the demographic details and all your job information, and that can take longer than you think. And if your application is late, it won't be accepted. So making sure that orals are set up, that you've got an account, you can access it with no issues, and you can start filling in that beginning bit with no issues. And then think about your white space questions. I think updates more will come through email. I think that's why keep an eye out for emails, and just don't leave it till the last day to submit it, because if there's something that slows you down, you can't upload it in time, and then if you miss the deadline, you miss the deadline, unfortunately. People worry a lot about the white space questions. I think writing them can be difficult and the word count can be quite tight. So writing them separately on Word does make them easier to edit and send to people. I think it's important to get some feedback, but I wouldn't send it to too many people, because then you'll start getting conflicting feedback and that can make it quite difficult. And I personally sent mine to someone not medical with the shortlisting criteria. So all of the information you need and what is used to mark your application is on the website, including the shortlisting criteria, which tells you the scores. So you can ask someone who's not medical to just read your application and score you on the mark scheme. And I found they picked up stuff that medical people maybe took for granted, because they knew, oh, well, you probably did this or you mean this, because we just give each other that bit of credit, but they might not do that in the actual process. So if you haven't written it down, you won't get points. So getting someone not medical to read it, I found really, really helpful. And then just making sure you're hitting those higher marks. The listing stuff is great to show your experience, but you'll notice in the shortlisting, all of those higher marks are for reflection, are for what you learned, for feedback you got. So making sure you include those things as well is really important. In terms of the interview, although it's virtual, treat it like a real interview. So I had one recently for my subspecialty training. You know, I dressed like I was going to an interview. I checked all my internet worked. I made sure there was no distractions. There was good lighting. I personally also wore a headset, which I know some people don't like to do, but I think it makes it much easier to hear what the examiners are asking you and also them to hear your answers. But that is kind of personal. But you'll get marked down if you've got a headset on. I know some people think that you just look silly, but I personally prefer it. It's all again available to you beforehand, so making sure you read what Simon's just been through, that's all in the applicant guide. Having a portfolio of reflective examples and cases you've seen, you don't need loads, but having it ready, and like you can physically prepare it. You can't, I don't think you can take it with you, we can check, but just having those cases ready rather than they ask you a question, you're like, oh, I've got to think of something. Having 3 or 4 cases you can bring up easily, especially for the reflective practice question, because that question is available beforehand. All that can be done beforehand, so I wouldn't shortchange yourself by not putting the prep in beforehand. And then finally, there's a point here about preferencing, so you can't do it till later on, as James said, but don't limit where you go. Like I personally went to Wales, it used to get a bit of a bad rap. Now it's very popular, the training there is fantastic, and I recently moved to Manchester and the training here is pretty great too, but they weren't places, or Manchester wasn't somewhere I thought I'd end up. So just have an open mind. If you can move, don't limit yourself, but please don't pick anywhere you wouldn't accept, because as soon as you decline an offer, you will get kind of booted out and you'll have to reapply next year. You can accept with upgrades, but obviously that's a gamble, and if you've accepted that one and you don't get an upgrade, then you are expected to accept and take up that post, or you leave the application process. So just to be aware when you're listing your jobs of those kind of limits, because people sometimes think, oh, I'll accept it, and then if I don't get upgraded, I can do something else, but you will just be removed and have to reapply. That's it.
Thanks very much. Yeah, and for that shameless plug for training in Wales as well. That's great. So I'm just going to give you a quick run through how the offers work. So once you've been through all the other stages successfully, if you are deemed appointable, so you've scored more than 55% of your interview, then you are in the running to potentially get an offer. But as Simon's mentioned, that is not a guarantee that you get an offer just through being made appointable. It's all based on the preferences, and so you'll be ranked with everybody else in the UK that's interviewed for whichever level it is you're going for. So once all the interviews are complete for the ST1 ones, all the various different centres that are running them virtually will pull their scores. For ST3 from the single centre, they will all be pulled together. And once that national ranking has been created, offers will be released based on where you place within it and actually what you've preferenced beforehand. So obviously the higher up the preferences you are, the more likely you are to get your first choice. You may not get your first choice straight away, but you may have the opportunity to get a better choice than the one you get offered initially. So just bear in mind that you've always got 48 hours to decide what you want to do with any offer that you get, and you've kind of got 4 basic options. So you can either accept it. So if you get your first choice, excellent, you don't need to worry about anything else unless perhaps something changes. But if you've got the one that you want and you know you're set on it, accept it, you're great, just hold on to it and then wait for your sort of information to come through from your for any more prospective employer shortly after the offers process completes. If you don't get your first choice, then you can accept it with upgrades. And essentially what this means is that every time there's an iteration of offers, people will either decline or accept, and potentially one of your higher preferences may get declined by somebody and may therefore sort of drop down the rankings, and you may end up getting that. If you do accept the upgrades are automatic, so you can't opt out of them once you've opted in. So if you get an upgrade, then you get the upgrade. You can't ask for it to be switched back, essentially. But if you don't get your first choice, then it's always worth accepting with upgrades, because there's always a chance that you could get upgraded. The offers will go on for at least a couple of weeks, and there'll be a number of different iterations, sort of every 3 days roughly. So bear in mind the upgrades, but if you get your first choice, accept, you're good. You can hold it. If you hold it, this is mostly for people that are applying to more than one specialty, where the offers might not be coming out on the same date, because you can't hold an offer in 2 different vacancies. So that's basically for that reason. There is a hold deadline, as there is an upgrade deadline, at which point the hold deadline will make you either remove you from the process if you haven't decided what to do with it, or if you've accepted it, then or you need to accept it by that deadline. So just bear in mind, if you're holding, keep an eye on kind of the offers dates for any other specialties you may be applying for. But if you're only applying for paediatrics, you don't really need to worry about the hold option. And as been mentioned a couple of times, I think if you decline it, then you are out of the system for that year. So just preference carefully again is the advice on that side of things. So just very quickly, just a few dates just to keep an eye out for there. All the timelines are on the website for ST1. All the timelines for ST3 will be uploaded tomorrow. So ST1 is open at the moment for applications. They close on the 23rd of November. The interviews are sort of end of January next year for a few weeks, and they'll be spread around. So there's a range of dates there that you can also see on the website. So it won't be every day within that period. It'll be about 12 days within that period. And then the offers for ST1 first lot are due to go out on the 19th of March. And there's that whole deadline that I just mentioned. ST3 wise, we've got the applications coming up, so 16th of November, and they close on the 7th. Apologies, I think I said the 5th at the beginning. It's the 7th of December that the applications close for ST3, and then the booking window and the interview window are all taking place early next year. So the interviews for ST3 are in March, essentially the start of March. Offers for them out about 3 weeks later as well. So the 11th of April will be the offers date for ST3 if you've interviewed, and again there's a whole deadline just to keep an eye on there. So the last point before we go into the Q&A is just to mention GMC registration. So this is basically for anyone who's applying from outside the UK who won't have GMC registration necessarily before they come and work in their UK training place. So you do need to sort out your own GMC registration is basically the key point here. So taking up a post, being offered a post and accepting it in national recruitment is not therefore a kind of prerequisite that you will then be started up on the GMC registration process. You need to be registered with the GMC in order to practice in the UK. So it may stop you from being able to take up a post that you've accepted come August, September time. So most of the rotations start in either August or September for the posts that are advertised in these next 2 rounds that we've been talking about. So make sure that you've got your GMC registration sorted well before August. Otherwise, as I say, you may run the risk of not being able to take up your post. And particularly if you've already made arrangements to kind of move from one country to another and so on and so forth, aside from the fact that you might lose out on being able to start your training that year, then you can see that could be quite disruptive. Do have a quick look in the applicant guide. It does have a section in there about this, but the key thing is just to start your own GMC registration process. It can take a little while sometimes depending on how busy they are. So I would suggest perhaps if you are in the process, particularly as you'll be getting sort of shortlisted in that over December and January, to start looking at setting up a GMC registration application sometime early in January, just to make sure that there aren't any delays. So just bear that in mind, as I say. We've mentioned it, I think all of us, there's lots of information around on the RCPCH website. The ST3 stuff is getting updated right as we speak and should all be live by tomorrow, Friday at the latest. This webinar will also go up on the web pages as well as the YouTube site for the college. The HE or NHSE training website has also got all the general info and timelines, but not really anything particularly different that's not on the specific stuff for the paediatrics, basically. During the operational period, we have a great team that work with us who are the Paeds NRO team, Paeds National Recruitment team in West Midlands. So they're the people to talk to about anything operational because they will be running all of that side of things. And as I say, this webinar will be available next week. So if you want to watch it back, or if you want to let your colleagues know if they haven't been able to come and listen live, then it will be there with plenty of links from the actual pages. So I'll hand over to Eloise.
Hello again, everyone. So there's a few questions that have been put in the chat, and you can still keep adding them in and we will answer them as we go through. So the first few questions that have come in are about the eligibility criteria on previous experience. And I think the first few questions were about previous experience to ST1. So I'll read them out. Does previous experience include overseas work in paediatrics? How does this translate to IMGs who have worked abroad in very different paediatric systems, but are still taking some time finding their feet in the NHS system? And then the other related question as well is working in paediatrics A&E setting considered PEDS experience? So I don't know who wants to take those two.
Shall I start, and then James or Blanche can come in? So the reason why we made the change this year for ST1 to have a maximum of 2 years of previous experience is that over the last few years, people have been applying, especially from overseas, to ST1, ST3 and ST4. Obviously this year there is no ST4 option. But many of these people had 5-6 years of experience overseas, which could, inadvertently discriminate against those coming through standard training who are just F2s and don't have any previous paediatric experience. So we wanted to find that middle ground, which was where we felt it was fair and for people to have 2 years of experience. So all paediatric experience that's post-foundation, no matter where it occurred, counts to that 2 years. If you have more than 2 years of experience wherever you've worked after foundation training, you will not be able to apply to ST1, and then you would need to apply to ST3. And as we've talked about earlier on, there will be more ST3 posts available this year and more people being interviewed than previously for that. So I hope that answers the question, but I don't know, Blanche or James, if you wanted to say a bit more.
I think I'd probably just add for the A&E question that it's described as paediatric experience, so it does depend on your job. If you're solely employed in Peds ED and you never do anything else, I think we probably would count that as paediatric experience. But if you are in an A&E department and you just sometimes work in Peds and sometimes work in Peds ED, normal ED, then I don't think that would count. And it's external from the foundation programme. So if you've done F1 or F2, those don't count. It's just 2 years experience after F2 or external to F2.
That's exactly that. I was only going to say the same thing about the emergency kind of situation. It has to be an actual paediatric emergency unit, etc. So if you're in general, then yeah, it's fine.
Thank you. And then there was a question on eligibility for ST3 regarding the exams. So do you need to pass 2 out of 3 exams before the offer date of starting the post or at the point of application? And they've been told 2 different things. So, I mean, the person's specification does say success in 2 out of the 3 papers at the time of application. So, yes, so it's at the point of application, not the offer date. Okay, all right. And then we've got a few questions, another question on the eligibility criteria for ST3 regarding 6 months of neonatal experience. So question is, can you please clarify what level of neonatal experience, level 1, 2 or 3, etc.?
Shall I take that because I helped to write the paragraph? So in the UK, for those who are overseas, then obviously we think about neonates as level 1, which is a local neonatal unit, which will, sorry, level 1, which is special care baby unit, which doesn't have any ventilated babies and looks after babies over 32 weeks gestation. Then we would look at a local neonatal unit, which is level 2, which will have much more prematurely born babies of say 27, 28 weeks, and will have high dependency care and will have some ventilated babies. And then there's the tertiary level 3 units, which will have many ventilated babies of all gestations down as low as 23 weeks, as well as perhaps paediatric surgery. So what we expect for people applying at ST3 is they have at least 6 months at level 2 level. So this means that they've worked on a local neonatal unit. They are familiar with attending deliveries by themselves for term and prematurely born babies. They're able to initiate care, especially in term-born babies. And they're also familiar with managing a baby on the neonatal unit, going through its entire length of stay and managing common aspects such as nutrition, infection, ventilation, perhaps including the use of non-invasive ventilation, as well as common complications. So, but it is 6 months of neonatal experience that we would expect. I hope that answers the question.
And as Simon says, that is a section in the guidance there which lays all that out. So don't worry if you haven't memorised everything that Simon just explained. It's also on the core capabilities form, as I think I mentioned earlier as well. So that'll need to be signed off by somebody who's witnessed your sort of abilities within that sort of level 2 area.
We've got a question on previous degrees, BScs before graduate medicine. Does that count as points?
No.
No, thank you. So some questions about the audit question. Does an audit need to be relevant to paediatrics? And then there was another question, does data collection for audit should that be included in the academic achievement section?
So no, it doesn't have to be in paediatrics, especially at ST1 level. I'd say at ST3 level, you're probably leaning towards having more likely to have a audit in paediatrics, but at ST1, if you haven't done one in paediatrics, that's fine. It's more about demonstrating you understand what an audit is, what it involves, and that you've been involved in that process. In terms of if you collected data for an audit, if it's an audit, it's not the same as collecting data for research. So you just need to make sure what you're referring to and what section it goes in. And it's all in the shortlisting guide, so it's quite clear. Just when you're thinking about it, be like, is this an audit looking at a process against the national set of guidelines or quality improvement service evaluation, or is this a piece of research looking at something kind of novel, is the way to think about it, I guess.
And could someone explain a little bit more about the portfolio question? The question here is what to prepare for the portfolio question. Do we actually prepare a file with certificates in, or what format do you want the portfolio in? So I wonder if someone could elaborate a little bit on that, please.
Yeah, so in the past, when we had face-to-face interviews, people would bring along a portfolio of 8 sides of paper with achievements. But we're not going to be going through that in the station. It's really something that's prepared for you to help you to answer those questions at the interview. So there's no particular format that we want it in, but we will want to know what you're most proud about that you've achieved, and what are your kind of best achievements to date that you want to reflect on. Could be something like a multi-source feedback where someone's given you some really positive feedback on something that you've done. Could be some sort of award that you've won, but there's no set pro forma. It's just whatever's useful for you to be able to demonstrate it in the interview.
Yeah, it's kind of to focus your mind, isn't it, really, just so you get a chance to pick out the things that you know will help you demonstrate all the sort of things that Simon mentioned earlier when he was talking about that station. So it's not a set sort of thing, but it is advisable so that you've got properly prepared answers that will show your kind of aptitude and your enthusiasm for the specialty.
And I'd also add, I am old enough to remember having to take a physical folder to my interview. And one of the things we had to include was like a bit of a career plan, a bit of an idea where we wanted to go. So when you're thinking about being a paediatrician and reflecting on why you'd be good at it, that's also a good thing to show that you've thought about the career and where you want to go. It doesn't have to be in depth, especially at ST1, but that does show real thought about why paediatrics and why for you and why you're suited. And that's kind of what they're looking for at the interview.
Thank you. Someone asked, does it matter if some of the shortlisting answers overlap skills? So, for example, could you put communication in transferable clinical skills section and also in reflection of clinical experience? I think what I would say first of all is obviously don't repeat the answer because you can't necessarily receive points for putting the same evidence down or same experience down. But does anyone want to say a bit more about that, particularly communication skills?
I would kind of approach it a slightly different thing. So you could say you've got the skill of talking to children of all ages, and that might be a skill you want to discuss in your clinical skills section. And then you might be reflecting on a difficult conversation and the communication skills you've seen during your experience, and that would be slightly different things. But I wouldn't repeat skills because you're not going to get double marks necessarily. So it's either part of your experience is something you want to reflect on, or it's a skill that you want to discuss, and they're different parts of the same thing, I guess.
I suppose the other thing. Sorry.
I completely agree.
I was going to say the other thing just to bear in mind as well is that it's not an exercise in producing a perfect piece of prose as well. You should be aiming to make sure you're hitting the marks that Blanche has explained when she's directed you to the shortlisting framework. So you don't get sort of scored for writing better English or whatever, but you do need to obviously be clear in demonstrating the various attributes and capabilities that are highlighted in the shortlisting framework.
Thank you. And someone is asking, what evidence do we need to provide for white space questions? How do we prove our audit, national presentation or leadership experience, for example?
James, do you want to give that a go?
Well, there's nowhere where you have to actually sort of put any PubMed numbers or anything like that. So, I mean, clearly we would hope that everybody is not going to be sort of making stuff up, but I guess the more detail you give, the more obvious it is that it's authentic stuff. I've not really got much else that I could add to that. Blanche, anything you can think of from having done your subspec one recently?
I would say it's a probity issue. We're all professionals.
Oh, yeah.
So at the end of the day, we don't check up on what you say. We take you at face value. But if it was found out that you had lied on your application or anything else, that's a GMC referable kind of offence. So we're all professionals. We're all adults. We expect you to be truthful because you're a professional, and that's what we expect, is what I would say. So we're not going to check it. But if it got found out, you'd be in big trouble.
Yeah.
And relating to ST1 applications for the leadership question, does prior non-medical experience count? So, for example, during school, do you prefer more recent leadership roles?
Blanche?
I think probably, like, I was a prefect in school. I wouldn't have put that on my application. You will have done more recent leadership, but you might not have recognised it as leadership. So this is a really good chance to reflect on something or something you've done at work or seen or at university. You can use non-medical examples. So if you do lead on scouts or guides, you're a football coach, those kind of things, you can use those as examples to show, especially if it shows you working with children. But I would have thought you must have something more recent than school related leadership. You're probably just thinking of leadership as a title rather than a role, which we all do. All doctors are leaders, that's what they say.
Yeah, you could think about it more of a organising role, perhaps. So, yeah, I think a bit broader, perhaps. We've got a question about less than full time. So people wanting to work less than full time, at what point do they have to specify this? Is it once they have an offer and they've discussed it with the employer? Well, I think it will be a question on the application form. So there'll be a box to tick there. And then I think you have to get in touch with the employer. James, do you
Yeah,
want to
memory.
I can come in on that one if you like. Yeah, I mean, we've got I think the most trainees working less than full time of any specialty, so it's very common. So absolutely, if you're thinking of working less than full time, then make sure you've thought how and in what sort of amount beforehand. You will indeed have a question on the application form where you need to say, yes, I'd like to work less than full time. And the key thing is then that you will need to speak to your employing region essentially as soon as you've got your post. So you tick the box on the application form, and then once you've got your offer, it's actually going to be in the offer letter this year as well, because it is a process which takes a little bit of time, because obviously, as you can imagine, I'm sure the medical staffing teams have to work that all out and make sure they can sort of fit everyone into rotas over the sort of summer months. So you will be directed to start contacting your prospective employer when you get your email saying, well done, you've been offered a post and accepted it. So it's kind of a two-stepper. Yeah, it's demonstrate that you would like to in the application form, and then as soon as you've got your offer and it's all confirmed, speaking to the region that you're going to be working in and making sure you complete any of the forms, etc., that they require.
Hey, and then I've just got one last question here. So if you do have any burning last questions, do please put them in now. So this one is about the new core capabilities form, and this person asks if a fully signed CREST form from outside of the UK can be used in place of this.
So the CREST form, the core capabilities form, are two different forms. So the CREST is the snappily titled confirmation of oh god, I can't even remember it now, but it's basically your foundation equivalent capabilities. So that's actually only required for SD1 entry. SD3, we don't need the CREST, we just need the paediatric core capabilities, and it's therefore paediatric based only. So CREST is general, so foundation equivalent, whereas the core capabilities is for SD3, not SD1, and that is paediatric specific capabilities.
Thank you. And someone has just put in the last question about less than full-time training again. Will declaring that you want to work less than full-time affect the odds of acceptance to certain posts? So as far as I know, I think James will correct me if I'm wrong, but they're all full-time or less than full-time posts. They don't specify. So anyone can work less than full-time and it won't affect which post that you can take up. So do correct me if I'm wrong, James.
No, spot on. Absolutely. Yeah, no problem at all.
Okay. Oh, another question. Okay, what if I change my mind later? Well, I think if you haven't ticked it on your application form, I think at the time that you have been given your offer, that's when you should then contact the employer and tell them that you want to work less than full time. Obviously, they know that people's circumstances can change, and you can change to work less than full time at any point in your training, so you don't have to commit right at the beginning to what you're going to do throughout your whole training time.
And you can start at 100% and then during training drop to 80% or 60% if your circumstances change. You're not signing up for 7 years at 100%. You can go up and down as you need once you're in. It's just because you're starting, it's letting the deaneries know early that they need to factor that in when they're doing the rotas. That's why they need to know early, that's all. Okay, well, that's all the questions. We haven't got any new ones that have come in. So is there any final words from any of our speakers today before we close this webinar?
I just think with the degrees prior to medicine, I probably should have said when I was answering that question, but even though they don't score you points on shortlisting, they are things that you can use in the interview to talk about what motivated you to want to be a paediatrician. So they're still part of your journey. They just don't score you any points on shortlisting.
And I suppose it's another question that does come up, which hasn't today actually as well, just about having parts of the MRCPCH if you're applying to ST1. They don't score points on the application shortlisting, and there's really no need to do any parts of it beforehand. Certainly no requirement to, and we'd probably recommend that you probably don't worry about that too much. If you're taking several years out between foundation and ST1, obviously no more than 2 there, then obviously you might have the opportunity to start taking some of the writtens, but definitely not something to panic about, and you'll have plenty of time to complete it while you're in training.
Yeah.
Other than that, wishing everyone good luck, and thank you very much for listening.
Thank you very much, everyone. Sorry, Blanche, have you got any final words you'd like to say?
Just good luck, I guess. Good luck with your applications, and we'll see you for the interviews.
Great. Well, thank you everyone for attending, and you can send us questions in afterwards, and as I said, the recording will be available on our YouTube channel from next week. So thank you very much everyone, and very best of luck with your application.